So I presented on PD-1, PD-L1 VEGF combinations and bispecifics at the recent TTLC meeting. And what I went through in the presentation is obviously we're very excited about the new data with these bispecifics, but I also wanted to contextualize that new data with the 10+ year history we've had with VEGF combinations in non-small cell lung cancer, because I do think one of the questions that we're facing as a field is, are we seeing the same drugs in just a different format, or are we seeing truly something new that's going to change how we use these targets going forward? And so in the presentation, I talked about some of the original trials from kind of 2015 through 2020, reading out even later, combining PD-1 inhibitors or PD-L1 inhibitors with freestanding VEGF inhibitors, including bevacizumab, lenvatinib, and others, as well as the newer data for the bispecifics. And if we kind of look at that arc, we're seeing that in the older combination studies, there was some signal. We had positive PFS and OS for the Empower 150 trial, which was the combination of atezo plus bev with chemotherapy. But we also had a lot of subsequent trials with similar combinations or with lenvatinib that were negative. And what we saw in a lot of those studies was an improvement in PFS. Hazard ratios were usually 0.7, 0.8 range, and then really no improvement in overall survival. And that is a theme that is true for VEGF inhibition in lung cancer in many different combinations with immunotherapy and without. So we tend to see with these drugs an improvement in progression-free survival that doesn't translate into a significant improvement in overall survival. The data we have for the bispecifics, the most mature data and the most results we've seen are for ivonescimab, which is a PD-1 VEGF bispecific that has been studied extensively in Asian populations and has actually gotten approval in China. And we are starting to see some of the early data for the global studies. The data we've seen from ivonescimab from their Asian studies include head-to-head with Pembro in PD-L1 positive patients, that's Harmony 2. And then we've also seen in combination with chemotherapy and squamous cell, which was presented at ESMO last year. And both of those studies have been very positive for PFS. We're seeing really nice hazard ratios, 0.5, clear separation of our PFS curves. But for none of these studies do we have overall survival data. So I think a big question in the field is, are we going to see these PFS benefits translate into an improvement in OS, which will be very different from what we've seen before, or will it be the similar VEGF experience where we have real improvements in PFS, no long-term survival improvements? The other place where we're seeing a lot of activity for these agents, or at least clinical trial activity, is in EGFR mutant lung cancer. This did read out again for ivonescimab in their Asia study, but we have also seen this read out for their global study. And here we saw, again, very nice improvements in PFS, moderate improvements in OS. And in the global study, that moderate improvement did not meet statistical significance, due in large part to the alpha spend and some of the statistical nuances around how they did it. The hazard ratio values itself are pretty similar at 0.7, 0.74, 0.79. So I think we're seeing signal. It's looking promising. Obviously, there's been a lot of discussion. I listed in the talk a number of different agents that are in earlier phases. I think we will have an explosion of these drugs in the next couple years. But I think the real question is whether this is just VEGF attached to a PD-1 inhibitor or PD-L1 inhibitor, or are we seeing a true synergy between the drugs that's leading to improved anti-tumor immune responses, which would manifest, to my mind, really as more durable progression-free survival and then more durable OS, where we see that kind of long tail of the curve really being lifted up. And so I'm hoping that's what we'll see, but it's still a little early to say.